It's a Bold Republic Radio Show Thursday edition. My name's Glenn Woods. Thanks for joining me. We head all the way down on Thursdays to Cheyenne, Wyoming, where Charles Katibi is standing by from Wyoming Liberty Group. According to Maureen, I'm supposed to be debriefed on what was a very close call for the state of Wyoming, and that would be Medicaid expansion. Is that what we're doing here? You're debriefing me?
That's right. That's right. Yeah.
That was a close call. By the way, there were some articles that I sent Maureen this week that had to do with the hospital in Gillette, Wyoming, and even another state, I think it was Minnesota, where people found out that, they could get Medicaid expansion absolutely free. Go ahead, sign up for Obamacare. But when you die, your kids will owe all of the premiums you were supposed to be paying.
Yeah, that's an interesting way that they collect these funds that are just never collected from the original recipient.
The whole thing is like a massive fraud. So what eventually happened in the state of Wyoming?
What eventually happened is after repeated attacks and after repeated attempts to push through Medicaid expansion, first the governor tried to do that by including it in his budget. That was removed by Tim Stupson on the Joint Appropriations Committee. Then, in his State of the State, he attempted to urge and implore and more or less beg on his knees and ask the legislators at large to expand it. They tried to include it in a budget amendment in the Senate. That was rejected 2-1, 20-10. It was rejected. So just attempt after attempt to insert it in, and it was just rejected again and again in the Senate and the Appropriations Committee, because we've just been looking at other states that have expanded it, and we've just been looking and seeing if actually these promises actually came true. Did they reduce uncompensated care? Did it save taxpayers money? Are patients better off? And on all three counts, Medicaid expansion has just been a huge disaster.
Well, and that's part of my question, Charles, that I have for you. Did you find in your search of all these other states, any state where it went well?
In what respect? I mean, this program has been off. There's been so many promises that this program has given as an excuse to expand it. Right. I mean, I mean, what are you referring like? Yeah,
well, in any way, shape or form. Okay, first off, and the money came in that they promised was going to come in.
Money does come in,
right?
But it goes through the Medicaid program. It's not as if people get it's not as if taxpayers get this wonderful check in the mail.
Right.
It goes to Washington and it comes back through the Medicaid program. And the Medicaid program has very strict requirements on how this money is spent. And the way the money is spent is that it actually ends up wasting a lot of care.
Yeah.
Because it's done on a fee-for-service basis, which means that doctors really don't have much of an incentive to provide good care. They have an incentive to provide more care. And because the reimbursements are so low, a lot of them don't even accept it. So patients are left worse off.
Well, I'm trying to break it down here. So first off, okay, so far, anyway, states have been receiving the money. But then we run into the problem of the reimbursement level through the hospitals, and that also runs into the problem of the number of people that show up to get this free care, which is what it is for them. It always overwhelms, unless you can find a place that it didn't. Every case that I've ever read, it's overwhelmed the system far beyond the estimates.
I'm not saying some people aren't helped. Some people certainly are. But if you really think about it, yes, money's coming in, but it's not just a benefit. There was a huge liability, a huge responsibility. In the case of Wyoming, we would have had to take care of 20,000, 30,000, even 40,000 more people. And so, yes, we're getting a lot of money coming in, but we have to take care of all these people. And what Medicaid has demonstrated is that no matter how much money they extract from Washington, they can't adequately take care of these people. They have some of the worst conditions, and a lot of times we see they'd even be better off if they were uninsured. Because when they're uninsured, they actually take the initiative to find better care. Right. If you go onto Medicaid, there's an assumption that you're going to be taken care of. And that's simply not the case in a lot of instances.
Right. And then we're not even taking into account, just in general, the financial damage that it does to the doctors and the hospitals and then the state.
That's another one. Absolutely. Yeah. So they have to pay these enormous administrative expenses just to comply with all the rules and laws involved with it. And a lot of times they have to pass those costs on to private insurers. I mean, people that are insured through private insurance.
That's something you and I always forget to talk about whenever we talk about this is, okay, so they expand it in your state, whatever state you're listening to us in. It's expanded in your state. Well, whoop-de-doo, but you as a citizen already have your insurance. You're never going to take advantage of this, so it doesn't affect you. Really? And you wind up going to the hospital or seeing the doctor for something, and you're wondering, why the hell's my bill so high? Because you're paying for this.
It's not just that. You're also paying for it in higher taxes because these costs, when these costs do explode, the government has to raise taxes to pay for it, or they can end up cutting services you depend on. So in Colorado, Governor John Hickenlooper, who managed to successfully expand Medicaid in Colorado several years ago, he's now urging lawmakers to cut hundreds of millions of dollars in building projects and infrastructure maintenance and tens of millions of dollars in college aid. So yes, this affects everyone because when Medicaid expands, it pushes out a lot of other programs that people are already reliant on. Okay, so in other words, you'll be covered at the hospital, but there won't be a decent road to get to the hospital. Great. Well, beautiful idea. Won't be a decent road. Your water systems might be a little leaky. Yeah, there's a whole number of things that could, there's a lot of knock-on effects, which not everyone is happy about.
Well, I have a great idea. Let's just listen to what Bernie Sanders said, and we'll just do this nationwide and force everybody into it. It'll be much better, Charles. You'll see.
Oh, absolutely. Yeah. But maybe Bernie Sanders should listen to what actually happened in his state. His state tried universal health care, which his state tried essentially Medicaid for all. Yeah. And in the end, what it turned out that if they did that, it would have cost the state twice as much in taxes as what they're currently paying.
And I remember the governor of the state, which ran on a single-payer healthcare system, everybody's going to get coverage and so on, he turned to the Obama administration and said, hey, can you help us out here? Can we have some money? Because we don't have enough money to finance this. Yeah. And even the Obama administration said, we can't afford, this is little Vermont. This is not very big. No, we can't afford to do this. And so he had to shut the whole thing down. The beauty for me, Charlie, was watching the quite literally hippie protesters show up at the Capitol and protest the Democrat governor because he said, I'm sorry, we can't afford to do a single payer system. It doesn't work.
I mean, it sounds great. I mean, covering everyone, taking care of everyone. It sounds great until you actually look under the hood and find out that it's going to cost just an astronomical amount, and you're going to have to make a lot of sacrifices. Yeah. And a lot of people aren't going to like those sacrifices. Doctors won't, patients won't like it when they have to wait in long lines, and taxpayers won't when they see a lot of cuts in services. Okay. Now, a state like Wyoming, population-wise, is the smallest state in the nation. Yeah. So couldn't a state, and we do get a lot of money from the minerals industry, et cetera, et cetera, et cetera. Yeah. Couldn't you make a case that it would be more doable in a small state like ours? Well, we don't really have much mineral revenue right now. We're projecting about a $700 million shortfall over the next 3 fiscal years. And we don't even have the money right now to pay for the size of our government right now. We had to cut hundreds of millions of dollars just to keep the lights on, essentially, for current programs right now. We had to cut a lot. And yet, while we were had to cut and slash, Democrats, some Republicans, and our governor even said, no, if we expand this giant entitlement, we would actually save money. Oh, yeah, because the government's going to give you free money. Oh, absolutely. Sure. Absolutely. But they never say that this actually has a huge responsibility to take care of people, and they don't actually aren't fully taken care of. Okay. Which is, yeah. All right. Well, okay. So the sucker was finally shut down. But the last time we talked about this, in the state of Wyoming, there's the problem of, well, it happens anywhere. It's like watching those bad horror movies that I grew up watching on Saturday afternoon, Creature Feature. You're going to love this, with Dr. Paul Bearer. It was just a great television series. And the monster always came back in the end.
So where are we now with that? Because I can smell it already. They're gearing up for next year.
Oh, of course they are. Yeah. Because what the problem with progressives right now is that they're stuck in this policy loop where the only way you can actually help people is through government. The only way you can actually provide people health care is by spending a lot of taxpayer money on a broken system rather than looking at alternatives. And a lot of people are, but unfortunately, a lot of Democrats and unfortunately some Republicans are stuck in this mindset that as long as we have the federal government spitting out money, that's the best way to do it. But probably they'll try again. I'm hopeful this is our last year because people should remember this. Once we enter 2017, this money is no longer free.
Oh.
So we have to pay for a portion of the cost. We have to start paying for 4% one year, 5% another year. And then once we hit 2020, we would be on the hook for 10% of the cost.
Right.
And hopefully by that point, we can actually look at states like Colorado and California, states that enrolled 3 times as many people. And we can take a look and see just how expensive Medicaid has become for them.
No, you can't do that, Charlie. No, you can't do that.
Oh, we can't?
You're talking about looking at the evidence.
Sure.
What are you thinking here? You can't do that.
Well, sure. We have ideals to uphold after all.
I have a quote that since I brought up Bernie Sanders, I have a quote that I'm going to play later this hour. Okay. Is Bernie Sanders talking about how great Fidel Castro's Cuba was?
Mm-hmm.
Yeah. So, and let's not forget, Michael Moore took a bunch of sick people to Cuba because, their healthcare system is far superior to ours. Even though you can actually make the case that the Cuban healthcare system is a series of human rights violations. But, no. See, that's looking at the evidence, Charlie. You can't do that. What are you thinking here?
That's the ultimate goal of that's the ultimate utopian socialist world right there. We can't possibly pop that bubble. We have 90 or 100 years of socialist theory to uphold here. After all, Glenn, come on.
That's right. Yeah, and socialist theory comes out of denialism. So how did we do in the state of Wyoming as far as how many people were? I expect maybe some Democrats from Jackson Hole we're pushing for this. But can you give me or even guess at some kind of a percentage in the legislature of how many people were for expansion and how many were against?
Not many. The Democrats obviously were. There were some Republicans, but the support in the House was so bad. It was so minuscule. They didn't even attempt to include it as a budget amendment. It never even took a swing at it in the House. In the Senate, it did. And it got 10 votes, 10 out of 30. So it failed 2-1.
Mm-hmm.
That's how little the support is. And fortunately, the legislators here are actually willing to look at the evidence, and they're willing to look at what Medicaid's track record is in other states. And they're just not seeing savings. They're not seeing patients getting the care they need, and they're not seeing hospitals doing any better.
So what's the governor's problem? Hang on. No, just think about that answer. More with Charles Katibi from Wyoming Liberty Group. Yeah, that be me. It's a Bold Republic radio show. My name's Glenn Woods. Thanks for joining me. Back down we go to Cheyenne, Wyoming, where Charles Katibi is sitting by. And here's where I have to worry about getting him in trouble because, we're going to do a mental evaluation of the governor. Now, I can say this. The hell's wrong with that boy? But now... You got to be more polite than me. I understand that. But I kind of wonder what is the mental disorder of somebody when you lay out that much evidence and say, look, every single state that has tried this has had major problems and is regretting it, but you still want to do it here? What? Well,
the misunderstanding lies with how popular he thinks this is. He thinks that if he expanded Medicaid, it will be a political advantage to him once his tenure in the governor's house expires and he has to and he wants to run for Congress. That's no secret. And the only reason I can think of that he wants to do this is he thinks it will help his chances. But Obamacare is not popular in Wyoming, and people are actually listening to people like you and me who are just explaining look, this isn't a ideological thing. This isn't really a philosophical thing. It's just looking at the evidence. And the evidence shows that Medicaid is just about terrible for everyone, in every stakeholder involved. It's terrible for patients, it's terrible for doctors, and it's especially terrible for taxpayers. So that's where the misunderstanding lies. He thinks it will actually help him politically.
Okay.
But yeah.
Well, but what? You had a but there.
Well, I mean, I would say, let's say he actually manages to get into Congress with those ideas. What is he going to do with them? The Speaker of the House, Paul Ryan, is right now working to undo just about every part of Obamacare and take healthcare overall, even beyond Obamacare, into a starkly free market direction. What ideas is he going to bring by saying, I expanded Medicaid, and I'm going to contribute to this conversation on healthcare?
Well, and for that matter, when not if, not might, not maybe, when government runs out of money, at some point they're going to have to start cutting back on programs like this. So he gets to go there and say, yes, I contributed something that greatly led to the bankruptcy of America long before it was going to happen. How do you talk your way out of that one? But,
well, for any Wyomingites that want to vote for Governor Meade for Congress, just think of this. He wanted to expand Medicaid. And let's say we expanded Medicaid. Once he got into Congress, what he would be doing then would be voting on and deciding on how much we would cut the reimbursements, or essentially the promise Medicaid offers to states. Because Paul Ryan has said this, and he said one of the first places we're going to take a hatchet to in the federal budget is that match rate that Medicaid expansion offers to states. Because Obamacare is certainly not providing that. The taxes, nowhere near, they're not collecting anywhere near enough in penalties to pay for it as part of Obamacare. So what they're going to look for is, how can we cut this? How can we cut it down so we can start to bring our debt down? And that's exactly the promise that Governor Meade is saying will be ironclad from the federal government.
Okay, well, let me, again, I'm going to say something that Charlie's not allowed to say because of the position he holds. Just remember, folks, whenever you vote for Matt Meade, you're voting Democrat. Just keep that in mind, because that's essentially what I don't care if there's an R by his name. That's what you're getting here. Okay, so does it look to you, I mean, yeah, there might be something geared up in the next session where we'll take one last gasp attempt at this. But is there a point when you see that it finally just dies and we don't have to have this conversation anymore?
I hope so. I hope they finally realize that nobody wants this. And especially now that we have a lot less money coming in from oil, gas, and coal, that just money isn't going to be there. Because it's no longer going to be free money where the federal government picks up all of the costs. We're going to have to pay for a significant portion of it in the years ahead. And I hope Democrats and the governor realize that there's just no political incentive for them to do it. Taxpayers don't want this. And the legislators, I mean, this isn't a full-time legislator. They're part-time. They have to go back to their constituents. And if they expanded Medicaid and had to cut a number of services to pay for it, they're beholden to them. They're answerable to them. And they don't want to have that awkward conversation with their constituents.
Well, see, the advice I would give anyone listening to us right now is just remember, anytime the government says about anything, hey, we're going to take care of this for you, don't worry about it, and it's going to be free, and it's not going to be a burden in any way, you can just guarantee it's going to be the biggest screw-up in the history of big screw-ups. And
it's going to be a screw-up. It's going to cost a lot more than was promised. It's going to deliver a lot less than promised, and we're going to have to pick up the bill. This is the same, whether it's Obamacare, whether it's highways, whether it's Medicare or Social Security. All these things have just been cost a lot more, and we're just not seeing many of the benefits.
All right, Charles,
so we really
thanks for coming on. Where can people find your work on this?
They can go to wyliberty.org.
All right, thank you.
Thank you.